our attention to a revolution that's happening not on our streets, but in our homes and our smartphones. South Africa's healthcare system is under immense strain, but a powerful new tool is emerging. Remote medical technology, from monitoring chronic conditions via devices at home to consulting a doctor on WhatsApp. Digital healthcare is transforming access and empowering patients. But how reliable is it? Is it a luxury for the connected few or a genuine solution for many? To discuss this, we're joined in our Johannesburg studio by Hillary Mukudu, the founder of TeledoctorSA. Dr. Hillary, very good morning, good afternoon rather, and thanks so much for coming onto the show.
Good afternoon, thanks for having me. Good afternoon to your viewers.
So the big question is, I mean, you talk about healthcare at your fingertips, but for millions of South Africans who struggle with data, doesn't this in a way almost enhance that divide between the rich and the poor, and certainly some of the privileges that they have?
Thanks for that question. Yeah. So when we're thinking of all these solutions, those things come into mind as well. And I think you mentioned WhatsApp already. And if you look at how many people do have access to WhatsApp, I think if you look at the digital revolution, many people are actually getting more and more access. Yeah. But when you talk about medical technology itself and the need for it, I think it's important, maybe I can just illustrate 3 numbers, and they're all related with stroke. So we know that stroke is quite a debilitating illness. Once somebody has stroke, even if they recover, they may not have their life as before, right up to the end of their lifetime. So there are 75,000 people in South Africa every year that get affected by stroke. Now, of those 75,000, 25,000 unfortunately do lose their lives because of stroke, and the 50,000 are the ones that survive. Now, the 50,000 that survive, just for hospital stay alone, not diagnostics, talking about rehabilitation and what is needed, it's about 20,000 rand. Now, you multiply the 20,000 rand by 75,000, that's 1.5 billion people that actually, 1.5 billion rands that is spent, and that's just a minimum. It could be triple, actually, that number, yeah. So now when you talk of a solution, what are the reasons why people have stroke? So mainly 2 things. First one is high blood pressure, hypertension. And in South Africa, you're talking about 8 million people that have hypertension. Some of them do not actually know that they have hypertension until they have stroke, which is a complication. And then you talk about people that have an abnormal heart rhythm. They may have hypertension. They may have also diabetes, which is also associated. That's type 2 diabetes. So that's about 4.5 to 5.6 million that have those conditions. But all those conditions require that somebody manages themselves, so they know what it means. If you have a blood pressure of 120/70, for example, what does it mean? If your sugar in the morning, you woke up, you had tea at 8 o'clock, what does it mean if you have a sugar of 10 or 11 or even 5 or 4? So those are the things that this technology is helping out, so that people can actually take care of their own health. They understand what the numbers mean. And then even the professionals, that's the doctors that are managing, instead of having a cross-section like ICU today, ICU again after 9 months, what happens in between I may not know, which may have an impact on how we treat patients. So that's where this technology from TeledoctorSA is bringing about. Yeah.
So Doc, let's talk about the quality of the consultation process, right? Now, if ordinarily I feel a pain in my side, or I've got a continual headache, or some other symptoms, I walk into a doctor, I go into a clinic, and I see a nurse, or I see a doctor, and they will feel me up, if you will, for want of a better description. And it almost gives somebody a sense of, okay, here's an individual who is looking after me, is concerned, and can almost diagnose. WhatsApp doesn't seem to give you that sort of assurance, does it?
Yes, that's an excellent observation. So one thing we just wanted to say, remember during COVID-19, I think this is where virtual consultation started initially. So the current virtual consultation is exactly what you were describing. And that is based on symptoms that somebody tells you. But now with this digital revolution that we're talking about, it goes a step further. Now the doctor will know what the blood pressure is, the pulse, which is a little more information than it was before. But I should mention that whatever these technological innovations that come in, they do not replace a physical consultation. So what we're talking about now, we're talking about a gap measure where you have data in between that allows the doctor to have a closer to a real version of what the problem could be. So it doesn't replace a physical examination. That is still very much needed. Yeah.
So let's talk about your technology and some of the things that you're offering. You offering certain devices. Let's talk about those devices and what it is that they will do for your patients.
Excellent. Yeah, so the first is just an entry point, and we know technology keeps on evolving. So the first part now is where we are able to see what the blood pressure is remotely, people that's at home, blood pressure or sugar or any other devices that can be connected. Now, the second part, remember I mentioned that number one, blood pressure is a big killer when it comes to stroke. The second one is an abnormal heart rhythm. So remember the heart, when it's pumping, at one point it needs to empty completely. There shouldn't be blood that pulls in it. So when somebody has that abnormal rhythm, what ends up happening is that there is blood that remains, and that blood forms a clot. And that clot, when it goes to a brain, it causes the ischemic stroke that we talk about. So there is a heart device that anyone can access, that can be available to anyone. And it's connected to your phone. So you put a heart sensor, you put it on the chest, connect to your phone, and remotely, your doctor will be able to see what the rhythm is. And somebody can wear it for up to 7 days, can shower, can do all the activities that are needed. And then as a GP, for example, I'm able to get guidance from a specialist who's a cardiologist by simply giving them access to that rhythm and the recording. So that technology was not readily accessible, but in this platform that we're offering, that technology is now readily available, even at the level of what we refer to as primary health care, so where the GPs are and the private care nurses are.
Dr. Hillary, what we've done is we've sort of critiqued this technology and potentially some of its challenges, but there's also exceptional access that it offers, for instance, to those people that are lying out in remote parts of South Africa, where ordinarily they would have to walk several kilometers, or doctors are not available. So let's talk about the value that it's going to bring to those individuals that are on WhatsApp, but then remote locations across the country.
Excellent. Yeah. So the first part is early detection. So since anyone can access even from home, we'll be able to detect, remember the 8 million hypertension, high blood pressure patients that I've talked about? So those that do not know would know. And then secondly, it also goes in the access, the speed of access to care. So for example, stroke itself, it's a problem for the rural areas. So people that are in the rural areas without access to a specialist, they wouldn't have access to the heart monitor that we talked about. Now, having access to that monitor, it means that they are able to get insights into what is happening when you talk about the heart rhythm. So apart from just being accessible generally, the access also includes the speed that it goes with. And we know with mobile phone technology, the accessibility even in rural areas is improving even now.
So two things. WhatsApp and access, I suppose, is I have my phone with me 24/7. Are your doctors going to be accessible to me at 2 o'clock in the morning if I have an emergency, is the first issue. And the second issue is South Africa has multiple languages, over a dozen languages. Are you able to cater for anybody who responds or has an emergency in a variety of languages? Yeah,
excellent. Yeah, thank you. Let me start with the second part that talks about languages. Yes, the platform has accessibility for all the languages that are in South Africa. Yeah. And the second part to say accessibility. So that's where even now, accessibility is supposed to be there. There may be challenges that we have here and there, and we know there's many other interventions that are coming up to address that. So in terms of doctors being accessible when they're supposed to be accessible, I think that's a law that governs all doctors or nurses or healthcare workers. So now this platform, what it does, it gives an alert. So if somebody, for example, has a critical blood pressure at one point, it will alert even the attending doctor. So the patients will select just in the same way that they select their preferred GP or their preferred healthcare provider, and that alert will be sent to them, and they'll be able to engage and arrange how they can assist the patient.
The question that I'm sure is on a lot of people's minds at the moment, Dr. Hillary, is the cost, right?
Yes.
It costs you anything between 500 to 1,000 rand to visit a GP, depending on where you are. What happens? What is the cost right now for this facility?
Yes, excellent. So in medical terms, the way we measure cost, we look at what is called cost effectiveness. So remember the numbers that I gave you earlier, the 1.5 billion minimum. So if you take that 1.5 billion minimum and you take the devices, how much the device cost, how much the app will be costing, and how much it costs to get a GP to see them, to have a virtual consultations, you can't compare. The costs are way more. So it looks at costs at the global level, but it also looks at cost to the patient themselves. So our wish for this platform is that the patients would be paid for example. If you have a medical schemes that would pay for, they have their chronic disease management funds that are there. We're looking at getting the providers to pay, or rather for the payers to pay for the patient and not for the patient to pay directly. And also, some of the things we're looking at, for example, if you talk about data, there's many other platforms that are zero rated. As we remember during COVID-19, there was a zero rating of data. So all those are things that can be put in. And I think when people do the numbers, we are confident that using the platform, using this intervention is way better than the current situation, the way it is.
So let's go back to the rural fact that we talked about, right? Now, some of these individuals are not on medical aid, so they are paying cash. Yes. What is the cost to that individual, right? The individual who says, you know what, I've got a pain in my side, or something's happened to me and I've got to go to the clinic, or I've got to go to a doctor. Yes. What is the cost to that person? Yes,
currently, if you look at the medical schemes, what they are paying, they pay, I think it's close to 50% of what the normal physical consultation would be. So the cost for virtual consultation is definitely lower. But obviously, there's factors in there that we've talked about. Like, for example, you mentioned about the accuracy and the importance of the physical examination being more accurate or superior to virtual consultations. That's one of the factors. But secondly, it will be the cost of the app itself. The app is in the cloud, it's secure, it has to be maintained, there's people behind the scenes. So we see most of the virtual consultation app, there's that added cost that is there. But that cost is not the same cost, it's actually less than the cost of the physical consultation. So we believe that getting more data, preventing these complications that happen. So if you prevent stroke, for example, what are you preventing? You're preventing hospital stay, the 20,000 that you talked about. You're also preventing rehabilitation, and rehabilitation for a patient with stroke.
Doc, I get the distinct impression that you're not going to give us a figure, and all too often when people don't give you a number or skirting around the number, then it's probably not as low as one would expect. But I'd like to move on to potentially one of the last questions as we wrap. And that speaks to liability and misdiagnosis, right? How does this app prevent lawsuits? Yes. How does it ensure that you are understanding exactly what it is that I am feeling, even though I may not be able to tell it to you as it actually is, something that you would be able to pick up if I came to your surgery?
Yes, excellent. So that's, if you look at the virtual platforms now, that's exactly what I would call a disclaimer that is always there. Yeah. With any kind of technology whatsoever, there is that element that needs to be factored in. Now, with our platform, it's not the platform that makes a decision. It's still the individual, it's still the healthcare provider that makes that decision. So when it comes to accountability and all those things that you mentioned, it still remains the healthcare provider that is taking care of the patient.
Fantastic. Dr. Hillary Mukudu, founder of TeledoctorSA, thank you so much for coming on to the show. And this is an absolutely incredible product, and we certainly look forward to more of it in the not too distant future.